guys, I am here at the Contour Clinics Castle Hill with Dr. Robert Laidlaw. Dr. Robert, welcome.
Thank you very much for having me, Kesha.
So what we want to talk to Dr. Robert about today is the ever so trending non-surgical butt lift. So this is done through collagen stimulating injections. Now, Dr. Robert, how exactly does that work?
So the substance is called poly-L-lactate acid. Comes in a powder form that we mix up, and then we inject it into the areas that we want to create volume and stimulate collagen, as the name suggests. It's seen as a really great, easy way, alternative to having surgery, to having liposuction or BBLs and those sort of things. It's done here in the clinic. It takes 5 minutes. It's relatively painless, and you start to see the effects after about 4 to 6 weeks.
Is it the same amount of vials that could be used for everyone, or is it something that needs to be case by case type thing?
When you come to Contour Clinics, we sit down and have a consultation. We go through what your expectations, your desired outcome is, and then we tailor a treatment plan just for you. So if people are just wanting a little bit of volume, perhaps maybe 2 or 3 vials per side, but people wanting that really big sort of Kardashian butt, they might need 4 or 5 each time. Generally, people repeat it after 4 to 6 weeks, usually with a total of 3 rounds. So if you were to start it today, you'd be looking at getting the result in about 4 months' time, if you sort of work it out from here.
So what can patients expect when they're coming in for this treatment?
So we mark up, usually in your underwear we'll mark up if you've got hip dips, which is, for those who don't know what they are, when the looking directly behind, the hips protrude out, and then where the hips are, there's an indentation, or a sort of, I guess, a crescent shaped indentation. So we're filling that in to give a nice outline of the hips. The second most popular place is probably on the buttocks itself, to give volume, to give that backwards protrusion, to give that big booty for shaking on the dance floor. I mean, for whatever reason you would like to do it. Yeah, and so it's a bit of a process, but the reasons people are doing it is to avoid having painful, potentially dangerous, definitely expensive surgery with a plastic surgeon or cosmetic surgeon.
So is it painful?
Look, most people don't have too much pain. Some people, obviously it is a bit of a needle to make the entry point for the cannula, but look, the whole thing takes a few minutes once we're set up. It can sting a bit for about a minute or 2, but look, it's really well tolerated overall.
What kind of post-care are patients looking at once they've had the BBL, non-surgical BBL?
I'm glad you asked. That's a very important thing that we stress over and over again, and that is this massaging, concept of massaging. We say 5 by 5 by 5, which is for 5 days. We want you to do 5 times a day for 5 minutes, massaging it really quite vigorously. And we demonstrate it when you're having the treatment, what we expect. The reason for that is twofold. One is to activate the product, but another one is to prevent the formation of nodules. It's a very rare complication of this procedure, but some people unfortunately do get little hard lumps. Again, it is treatable when it's not the end of the world, but prevention is better than cure, so we can prevent them happening. That's kind of the best way to go about it. If you massage it with those instructions, you just don't see nodules, it just never happens. So it's a very effective way of preventing that.
So can you use these collagen stimulating injections anywhere else, or is it just for the buttock area?
Yeah, I mean, so they were designed actually for the face, I think they were used in HIV patients actually with lipo atrophy from wasting away. We now use it in middle-aged women who are losing collagen in the face to give them a lift. We can do it off-label in anywhere on the body really. Yeah, it's not restricted to those places. Abdomen, yeah.
That's interesting.
On the breast, people do get breast lift from them.
So wow, you can really just use it sort of anywhere.
You can. Look, the main place is the face, and then the buttocks and the hip dips, but everything else is negotiable.
Well guys, if you have any other questions about the non-surgical butt lift or the hip dips or even the face, as we say, reach out to our comment section and we'll get back to you. Thank you so much, Dr. Robert, for joining us today.
Thanks for having me.
Bye.